This is Radio Health Journal. I'm Reed Pence. This week, how widespread mask use has impacted language development in children.
Our society did what it had to do, a very serious health condition, but now we have to deal with the consequences.
What can parents and teachers do to help when Radio Health Journal returns?
I'm Nancy Benson, host of Radio Health Journal. If you enjoy listening to Radio Health Journal, you'll also like our sister show, Viewpoints, which covers a wide array of topics from education to history to the environment. Here's a preview of what they're covering this week on Viewpoints.
We don't need more and more processed foods, much of which is getting dumped in the global south.
The pervasiveness of palm oil. Then,
I typically run maybe 60 to 80 miles a week, sometimes more than that. And I also do a lot of cross-training.
The life of an ultra-marathon runner. I'm Marty Peterson.
And I'm Gary Price. These stories in depth this week on your public affairs magazine, Viewpoints.
Listen to Viewpoints on your favorite radio station and subscribe and listen to shows anytime on Apple Podcasts and Google Play.
Over the past year and a half, COVID mitigation measures like social distancing, mask wearing, and virtual meetings have changed the way we communicate with one another. But they may also have unintentionally changed the way our children communicate as well. Researchers are studying the pandemic's impact on language development in infants and elementary school-aged children.
Our society did what it had to do, a very serious health condition. But now we have to deal with the consequences of those decisions and how our society organized ourselves. And there are going to be consequences.
That's Stephen Camerata, professor of hearing and speech sciences, psychiatry, psychology, human development, and special education at Vanderbilt University. Camerata is also the author of The Intuitive Parent: Why the Best Thing for Your Child is You. He says from the moment they enter the world, babies absorb an enormous amount of auditory, language, and communication inputs. Even preemies staying in the neonatal ICU are impacted by everything going on there.
There's a literature on preterm infants, and they tend to hear machine noises because they're in neonatal intensive care units, and that affects their auditory development. So even the earliest input that children get, auditory input and visual input, has a profound impact on shaping the way their brain ultimately gets organized. So it's very important.
Impacts on language have come from a variety of changes during the pandemic. For example, mask wearing has had an impact on our physical ability to be heard. Sarah Charney, a speech pathologist specializing in voice and swallowing disorders at the Mayo Clinic, Arizona, says all masks, but especially N95 masks, tend to muffle sound.
Some of the masks that we're wearing, so the kind of commonly worn medical masks, the decibel level or loudness of certain high frequencies are actually decreased by they're saying about 3 to 4 decibels. And then for those N95s, what we're wearing in the hospital every day, could be decreasing it by up to 12 decibels. So that's a huge difference just with the mask alone, disrupting that speech signal.
And of course, masks also obscure many of the nonverbal cues that are important in successful communication.
We communicate a lot through facial expressions, probably more than we even realize. Emotions, intentions, implied meanings, things like sarcasm you would never get all the time, if you weren't always looking at someone's face. And if you ever, watch parents talk to their infants or adults talk to young children, you know that you can see their exaggerated facial expressions, right? Like extreme smile, extreme frown, surprise face, all those things that you're trying to communicate a message even before they've developed language. Right? You're still communicating a message. And that's, I think, a huge thing that we think about with speech and language. It's not just about the words, but it's actually about the emotion that you're trying to communicate or that implied meaning.
Charney explains that a lot of the early language development in infants and young children has to do with understanding physical facial cues.
When babies are learning language, they are constantly looking at your face, right? And so we've learned in the literature and research that they actually start to pay closer attention to the mouth between 4 and 8 months or so, and they essentially begin kind of lip reading. So They're going through the stages of babbling, and they're essentially duplicating lip and tongue movements. Young children are very visually oriented, so they are constantly watching your eyes, they're watching their lips, and they're coordinating them, which is just a huge part of speech and language development. So we can see how if somebody is half-faced, what I'm calling with the mask, then you're missing that information. And so now it's becoming a little bit of a mismatch, right? So they're relying on this auditory information, they're relying on this visual information, and now that integration of the two can't really happen.
Children usually put things together quickly. After just a year, they're often saying their first words.
Children start putting two words together within the next 6 months after that. Then there's kind of a big vocabulary explosion. They go from around 50 words on average at a year and a half up to 300-400 words. I'm talking about expressively now. Receptively, they can understand more than they can say. There's that imbalance. But anyway, by the time they're 2, they have hundreds of words vocabulary. They're using 2 and 3 word sentences. In terms of speech production, their ability to make speech sounds is pretty much complete by the time they're 7.
However, since the start of the pandemic, children of all ages have had to face new challenges. It hasn't been studied yet, but Camerata predicts that some ages could be hit especially hard because of their developmental stage.
Let's say I'm a 7-year-old, my language is pretty well developed, I'm going to be able to fill in information. But let's say I'm a toddler. I would hypothesize that it's really the most devastating for like a 2-year-old to a 4-year-old, because there's a lot of language that happens then. We know that they're going to get input, non-masked input at home, because parents aren't going to be wearing their masks necessarily at home, but out in public or, in school situations where the teacher's masked, I think they're the ones that are going to have the most difficulty filling in missing information.
However, communication issues haven't been limited to physical challenges like mask wearing and face reading. Since many children have been home most of the pandemic, they've missed out on the social nuances that happen in communication with other kids and adults.
Something that we talk about a lot in the speech and language world is peer talk, which is kind of a crucial component of what we call pragmatic development. So that includes conversational skills such as turn taking and understanding the implied meaning behind a speaker's words. And many of these children are living in either a virtual world or, like I said before, kind of a faceless or at least half faceless world. So I think it's important to kind of think about what this could mean, not only in terms of speech and language development, but also socially, because they are kind of missing those natural interactions that we get every day.
Speech sound acquisition, visual input does help, but the more subtle aspects, the social aspects, that's where visual facial expressions are really important. It's important through all of it, but really important in social interaction. I think as things are starting to open up, I think it's really, really important for parents to understand that our teens have really been hit hard with this because of isolation, social isolation, and how important peer groups and peer interactions are.
Both Camerata and Charney say that speech and cognition challenges have been magnified even more for those with hearing loss or other disabilities.
One of the research areas I do is what we call speech intelligibility or speech comprehensibility in children. And so one of the populations I work with, some of my favorite people on the planet are people with Down syndrome. And so, because of the oral architecture and because of the different motor patterns that people with Down syndrome exhibit, it's really, many of them have difficulty with speech. And people with Down syndrome are quite social on average. And so when they're not able to make themselves understood, it can be very frustrating. And so you can imagine that putting a mask on someone with Down syndrome, would make it even harder for someone to understand what they're saying. And I have, some of the families have communicated that to me.
Children with hearing loss can face even greater social isolation, increased frustration, and mental health challenges.
Those with hearing loss, we do know that they can often feel more isolated, especially in public places where they are, fighting over noise. That's really, really difficult, and it's cognitively taxing. And now with the added burden of the mask, they're fighting that as well.
The bottom line is that we're integrating cues from lots of modalities, and seeing someone's face and mouth is very important. Children with hearing loss, they have to scaffold what they hear because they're not hearing all the information. They have to scaffold it with other cues like facial expressions and lip reading. And I can just tell you as a clinician, when we first came back to in-person and we wore masks, literally some of the children were in tears because they just could not understand what I was saying. They could hear it, but without information from my face, it was just very, very difficult for them.
And on top of this, Charney says there's still a lot of stigma surrounding hearing loss.
With visually impaired, we've made it fashionable, right? People want to wear glasses when they don't even have a visual impairment, right? So I think the idea of hearing aids, cochlear implants, all those things have not quite been normalized as much as visual impairment has. And so, yes, I totally agree that people are often nervous about saying, hey, can you repeat that? I didn't hear it, the first 3 times.
However, because mask wearing has been an ongoing reality only now starting to give way, it's been difficult to measure its impact on language development. What is clear is that researchers will be keeping an eye on long-term effects.
It's a little domino that's going to have repercussions down the line. And so, yeah, it's a bump in the road, if you will. And it's something where resilience is going to be needed where historically it wasn't needed. And so, yeah, I don't want anybody hearing this to think that they're permanently harming their child by wearing a mask, if that's what they're supposed to do. On the other hand, I think it is important to be mindful of that and say, okay, well, when I'm home, I'm going to spend a little more time talking to my infant without a mask.
And for people with hearing loss, Charney says there are small habitual changes that everyone could make that would make day-to-day life easier. For example, even though clear masks are not especially popular, they can help with lip reading and understanding facial cues. She also says we can be more cognizant of how we're speaking.
We talk about this a lot in the voice world, is the idea of using crisp, clear speech. So over-articulating, especially when you don't have that visual input with a mask, right? So even overdoing the consonants, that can really, really improve your intelligibility without more effort and actually helping out your listener too. And they can hear you better and understand you better without really having to increase your volume necessarily.
So what can caregivers do in the meantime to address learning loss? Instead of stressing out about reading scores or having your child use more technology, Camerata says, surprisingly, try heading outside.
What I really want to urge is that families spend time talking with their children, interacting with their children, playing with their children, taking their children to the park, and doing these kind of things that are family building and also are such an important part of the rubric for learning. It's a foundational kind of activity that really is so rich and so special. And that's been displaced big time. The magic of that is really understated because it's so common, but it's such an important aspect of development.
That's not to say school doesn't have an important role. Charney says teachers are very important.
I think if they can also make sure to be using multiple modalities, right, in their teaching. So maybe more frequently verifying, did you hear that? Did you understand that? And just kind of having that conversation just to make sure that the children and the older children too are accessing the content that they need, both maybe auditorily, visually, in other ways. So we can just make sure that they're not missing out on information.
You can find out more about all of our guests on our website, radiohealthjournal.org. Our writer-producer this week is Libby Foster. I'm Reed Pence.
Birds are chirping, flowers are blooming, and your allergy symptoms are knocking you out once again. If every year you dread warmer weather because you can't seem to get ahead of your allergy symptoms, and if you feel as though you've tried every medication in your local pharmacy, it may be time to see an allergist. Dr. Luz Fonisher, president of the American College of Allergy, Asthma, and Immunology, says sometimes over-the-counter medications just don't cut it.
Allergists are trained to work with you to get allergy and asthma symptoms under control. They can do testing to diagnose exactly what you're allergic to and also determine if treatments such as immunotherapy in the form of allergy shots or tablets might be effective. Allergists are also asthma specialists. Many people don't know that asthma is often connected to your allergies.
If your allergies are making you miserable and you need expert help, find an allergist near you. The American College of Allergy, Asthma, and Immunology has an allergist locator on their website at acaaI.org.
Cardiovascular or CV disease is the #1 killer of adults in the U.S., and millions of people trying to reduce their risk of a heart attack or stroke may unknowingly be taking medications that are not proven nor FDA approved to reduce cardiovascular risk, Let's hear from cardiologist Dr. John Osborne.
Many people are unaware that after a failed outcome study, the FDA revoked the approval of fenofibrates when added to statins, as the risk outweighed the benefits to heart health. It's important to remember that statins, along with diet and exercise, can lower cardiovascular risk by about 25 to 35%, but persistent cardiovascular risk, which can lead to a life-threatening event, may remain. I would tell anyone still being prescribed fenofibrates, such as Tricor and Trilipix, with a statin, to talk to their doctor about FDA-approved therapies for cardiovascular risk reduction.
To learn more and get clear on the facts, visit itscleartomenow.com. Again, that's itscleartomenow.com.
COVID-19 vaccines are rolling out, and many Americans are looking forward to getting back to normal. However, chronic stress of the past year can impact memory, mood, and anxiety. So during June, Alzheimer's and Brain Awareness Month, the Alzheimer's Association reminds you to make brain health a priority. Beth Kallmeyer, Vice President of Care and Support for the Alzheimer's Association, has tips to restore mental well-being.
First, think about recommitting to brain-healthy basics, like regular exercise, a heart-healthy diet, and getting plenty of sleep. Try to unplug from technology every night. Do what you can to manage your own stress, especially if you're a caregiver for a person living with Alzheimer's or dementia. And return to normal at your own pace by taking small steps and setting boundaries.
Kallmeyer says it also helps the brain to help others by volunteering in your community. For example, by supporting the Alzheimer's Association's The Longest Day event, June 20th. Find out more about Alzheimer's and Brain Awareness Month at alz.org.
And that's Radio Health Journal for this week. Radio Health Journal is a production of MediaTrax Communications. Follow us on Twitter, Facebook, and Instagram to learn more, and check Apple Podcasts, Google Play, and Spotify for a library of past programs. Plus, you'll always find previous segments and information about our guests at radiohealthjournal.org. Join us again next week for another edition of Radio Health Journal.
Coming up next week on Radio Health Journal.
Why did Julian pass away? That's the number one question I have, right? Because we don't have an answer yet.
The mysterious deaths of some 400 American children each year.
Then tonsil stones, a little problem that causes a big stink.
I just operated on a 46-year-old for tonsil stones, so they can come at any time.
All that and more on Radio Health Journal.